Hi, I'm Dr. Basma Faris, OBGYN and culinary medicine specialist. Today, we're going to talk about popular weight loss diets, what works and what doesn't, and why. So first, let's start talking about good old-fashioned caloric restriction. The concept behind this is that we consume fewer calories than we burn in a day. And I'd say it's probably the most popular strategy. It is the strategy that's behind popular programs like WW and even Noom that uses some more mindful eating strategies. It also has a component of caloric restriction. People that track their macros, also, again, caloric restriction. And the idea is that if you burn fewer calories in a day than you consume, you'll actually burn some excess body fat. And it does work to a degree, and it can be a successful strategy for losing a modest amount of weight gain. The problem is our bodies resist change. Our bodies like to maintain our current status and our current size. So as people's weight goes down and their body fat decreases, we will then produce less of a hormone called leptin. Leptin is a hormone produced by our fat cells, and I like to think of it this way. Leptin starts with L, and L also stands for lose. So as we have less body fat, we produce less leptin, and then we're less likely to lose weight. So what tends to happen is people will lose weight for a period of time, and then their weight will plateau. And they either need to just maintain for a little while and try again, or they need to make a further caloric restriction so that they continue to lose weight. And so for that reason, it can be frustrating and only result in modest amount of weight gain. So if somebody has a larger amount of weight to lose, this may not be the best strategy for them. Now let's talk about a very popular diet, the ketogenic diet, which is also just called the keto diet. And the concept behind the keto diet is that if you only consume mostly fat, an adequate amount of protein, and very little carbohydrate, it forces our metabolism to convert to a carbohydrate-utilizing metabolism to a fat-utilizing metabolism. And that allows people to tap into their fat stores and allows people to tap into any stored fat that they have in their liver. This diet can be a great alternative for people who have a larger amount of weight to lose, that maybe don't want to undergo bariatric surgery or can't afford expensive weight loss medications. They may turn to the ketogenic diet because it does work. But as with most things, there are some caveats. It is a lower fiber diet. And for that reason, people may suffer with digestive issues such as constipation. It is a lower fiber diet, so it may have a negative impact on our gut microbiome, and there's some concern about colon cancer risk if somebody doesn't eat adequate amounts of fiber. And it can be difficult to maintain because you can't maybe necessarily always eat out. So in social settings, it can be challenging to follow the ketogenic diet long term.